It's 8:41, new on Daybreak. July is Mental Health Month. Here to talk about the importance of mental health awareness and why it's especially important now in minority communities is Dr. Danielle Henderson. She's a clinical psychologist at IU Health. Good morning, doctor.
Good morning.
So we've discussed this before, but kind of talk about how racial and ethnic minority groups are more likely to be affected by mental health issues.
Sure. So one thing I wanted to make sure that I said, particularly with Minority Mental Health Awareness Month, it was something that was started in 2008 to draw attention to this, to draw attention to the fact that mental health conditions do not discriminate based on race, color, identity, sexual identity of any sort, and then also to bring attention to the fact that often in minority communities there's stigma associated with talking about mental health, stigma with seeking help and getting the information that those communities need.
So what are some examples of maybe the barriers to mental health care that people, especially in these minority groups, can face?
Sure. Well, just in general, in some communities, there are not discussions about mental health at all. So when people are maybe experiencing different symptoms, not quite sure what to make of that or what those things might mean, there's a stigma attached with seeking mental health treatment. So even talking to somebody else about what you might be experiencing in different communities, some people might feel shame because of that or be told that that's shameful to share your personal difficulties with others or to share the difficulties of the family with other people. And there can be this misperception that it's other people in society who seek help, maybe not particular minority groups. And that can do a great damage. And also thinking about different communities that might have resiliency or protective factors. Sometimes, particularly when it comes to mental health, there's a lot of reliance upon those things. So thinking that different spiritual or faith practices will solve it all and not being open to appropriate mental health treatment.
And is there maybe some kind of mental health condition or issue that someone might be experiencing? Because I think the mental health umbrella, it's very broad. And to say, I have a mental health issue would, not really hone in on what that issue is. So is there something that's specifically in these minority groups because of experience or because of any certain reason? Is there one particular issue or a couple issues that you feel these groups, suffer with more commonly?
Sure. Well, I think definitely, like we've talked about before, with current situations going on, trauma and PTSD is definitely a big one to think about. General anxiety, depression, grief, loss. Those are all things that particularly minority communities might be experiencing right now and not quite sure what it is they're experiencing and needing someone to talk to and seeking some help.
All right. Well, thank you so much for taking some time to talk to us this morning. Of course, we do have some resources available to you that can help you with some mental health resources on our website, wishtv.com. It is